So, one concerning trend as a pediatrician I've noticed over the last few years, and especially the last two summers, is that back in the old days meaning just a few years ago, we would normally see a lot of cold and flu stuff in the fall and winter. That was the cold and flu season. And then spring and summer was a bit of a break. You didn't see a lot of upper respiratory stuff. However, lately, especially the last two summers and definitely this summer, I feel like there's been a large number of upper respiratory infections in the middle of summertime. Like this past month, I've been seeing a ton of rhinovirus, adenovirus. I even saw COVID, saw flu. I myself had some terrible bronchitis that lasted several weeks, and I still don't have my voice back. And I know some parents who dealt with what I have. And it just seems like there's been a spike in upper respiratory illnesses in the middle of the spring and summer, whereas we would get a break from that before. And I'm not really sure what the cause is, to be honest. I've just noticed it over the last few years, possibly related to COVID, because I feel like all this followed that. But it's been pretty rough on doctors and patients. Kids are getting sick through the summer. When I walk in my schedule, I just see it full of kids with upper respiratory infections and fever. And us as doctors are obviously a little bit overwhelmed because we're dealing with this stuff not just during the fall and winter, but now through the entire year. So I guess this is the new normal, but I hope things get better. And hey, maybe it's just something I've personally noticed, but maybe it's not the new normal. I hope it's not. But if you're a parent or a healthcare worker, let me know if you felt the same way.